I am a holistic chiropractor based out of St. Charles, Missouri. When I was an undergrad in college, I got a job working part-time for a chiropractor. Gave me my life back. It took care of my seasonal allergies when nothing else was working, and I was impressed and amazed. So I went back, and then I was blessed enough to have two different mentors, her and another person who mentored me with the clinical kinesiology and the hand modes. And the one mentor, I worked with her for 5 years, and she focused heavily on the emotional aspect of it. We have chiropractic practice, a holistic minded chiropractic practice, where we incorporate a lot of different modalities, including muscle testing with applied kinesiology, clinical kinesiology, which has to do with hand modes to help talk to the part of the brain that controls the body so it can guide us and to what it is each individual patient needs. And with that, we're able to base recommendations for supplements, homeopathy, whether someone needs acupuncture, laser work, soft tissue work, fascia work, adjustments. We let the body do what it is designed to do and heal naturally by its own innate ability. We also do a lot with allergy desensitizations for food sensitivities, food allergies, food intolerances, environmental, seasonal issues. And it just helps incorporate a lot that we get to work with people who've gone to other healthcare practitioners and were told that there's nothing that can be done and they just have to live with whatever it is they're dealing with. That's who tends to come into our practice very often because we're able to help them get well and see results. A lot of that is going to be with food sensitivities and intolerances. It's all around us, and they're told that, oh, well, you're having issues with corn or wheat or dairy, and so they're told just avoid all of it. And so some people will, but they're still not getting all the way better, because what I've discovered is there's often a multifaceted issue going on, that it's not just one or the other. Sometimes someone might be reacting to something like B vitamins or vitamin C. Well, our body needs B vitamins and vitamin C in order to function correctly. The body may not be utilizing those nutrients the way it's supposed to in order to aid and support the immune system to keep everything in balance. I've definitely had a lot more patients coming into the practice dealing with anxiety as a whole, of all age groups, but especially teenagers, 20-year-olds, 30-year-olds. I'm able to do with my practice and the colleagues that work with me. We use the muscle testing, which is with applied kinesiology, but we also add a technique called clinical kinesiology that uses hand modes in order to talk to the part of the brain that controls the body, like the brainstem and cranial nerves. That's the part of the brain that controls everything in the body to, in essence, keep the body running. And emotions can get trapped at different places in the body. So if somebody's having some anxiety symptoms going on, it's an epinephrine rush. Fight or flight is going on. The heart rate increases, panic sets in. All of that goes on at one time. And so we're able to utilize the hand modes to kind of let the body guide us as to what it is that needs to be done to help free up the trapped emotions, whether it's anxiety, fear, frustration, anger, rage, whatever emotion it is. And we use different like acupuncture, lasers, soft tissue work, even some chiropractic adjustments, but we let the body determine the order of operations as to what needs to get done. But what's really neat is we allow the patient's own body to guide the process. It's kind of all connected in a way. It's more of a niche that we do within our practice. Others who use hand modes to work on stuff don't always necessarily work with unblocking the emotional aspect of it. But, somebody, for example, who can't, quote, hold an adjustment and they have to go get adjusted 2-3 times a week. Well, when we're able to tap in and find the emotion that's been holding on and stuck in that part of the spine, we work with it and it frees up and it just kind of releases. And then the person's able to hold those adjustments better. We just kind of work with it. Whatever the body needs is what we do for that body. It's letting the body guide and having the knowledge and the where to of how to proceed and what to do with it. People are just stressed. We work with all ages. We do have a high for the emotional work. We definitely are seeing an increase within the millennial and Gen Z. I mean, we went through trauma back in 2020, and so things have definitely picked up since then. But we really work with all different kind of demographics. But yes, that age group specifically, we've seen an increase with anxiety specifically. I personally believe it's probably a nationwide crisis. We have it here I think most cities probably have it just because it's more densely populated. We definitely have seen an increase within. I would venture that it's more of a national issue. The Western medicine model is not getting to the core of the problem. They're giving prescriptions, but then it's not always working. And then I hear this all the time, and then they have to try a different prescription, but then there's so many side effects, they're not feeling good. And so it's just kind of a game of finding the right prescription, but then some people never can find the right prescription, but it's not really solving the problem. We can come in and kind of help guide the person and hopefully get them lowered prescriptions or off prescriptions, but we don't do that. We let the primary care doctor or the prescribing doctor do that. But as we work with someone, they start to get better and feel better. And then they're able to talk to that doctor and kind of taper off a bit of those prescriptions. It's the overall goal of the practice, and sometimes it does involve homeopathy or sometimes essential oils. It's just the olfactory receptors for breathing has more nerve endings than anything, and that's where emotions get triggered very often is with smells. Herbs, whatever it is that the body is muscle testing for, is where we go. Oftentimes, if a patient's coming in to see us and they're already working with a therapist or a counselor, they tend to get a little better results faster because we're able to kind of work on what you call the subconscious part of the brain, dealing with those emotions. And the therapist is able to help get the person thinking more on a conscious level of what is going on and how they can work with it. So we work really well together with therapists. So with nutrition, I focus more on trying to educate each person a little bit on proper food choices. Not a fan of soda. I encourage water. Everyone should drink half their body weight in ounces of water every day. It's more about the nutrition aspect has to do with, does your body need aid in some form or another? Is it something specific for the gallbladder that we need to help or something specific for the liver? I will do what is called like a multivitamin. Very rarely though. I'm not a huge fan of multivitamins because a lot of times somebody doesn't need everything in a multivitamin. So I'm able to hone in and narrow down specifically what that person's body needs. It's a form of frequency medicine, right? So it's letting your own body's frequency see what it matches up with the herb that has the right frequency, because real food, living food, herbs have frequencies. And so we use muscle testing to get into that. And that brings up that it's a form of frequency medicine. And so when we're talking about the biochemistry, which of the body, which has to do with, how the body's working within inside itself, herbs, homeopathy. I say nutrition because there's a hand mode for that, but that's basically a supplement. If somebody needs a specific supplement, I can do that even remotely over Zoom, which is what we just added to the practice recently. I can also work on unblocking emotions remotely over Zoom. I can tap into the body and work remotely to see what it is that person is needing. We integrate all of it together. It all works simultaneously together, right? But it's based on what that person needs on that visit. Even the person won't get the exact same treatment when they come back for a follow-up visit in 3 to 4 weeks. Letting the body guide the whole process. We integrate all of it together based on what the body needs. And so we block out 45 minutes to an hour to work on someone that allows the body time to process through everything, and we can dig in and do the next thing. It's kind of like a filing system. When we're working on someone, if they come in and I'm like, all right, we'll go ahead and lay down, and I start working on them, and it goes into an emotional file. It's like a filing system, right? Oh, we got to work on an emotion first. So I find which emotion it is, and I quote lock it in, hit the save button, so to say, and then I move on. Oh, okay, well now we got to do some acupuncture. So then I'll do acupuncture. And then I get that going, and then I check the next file that has to be done. And I just keep going through that whole process until the brain gets to the point that says, okay, I have enough files open, kind of like a computer system. I can't open any more files right now because I can't compute anything else at the moment. So I just let the body do its thing and rest there with the acupuncture needles, laser, whatever stones or crystals we use too at times. Let the body readjust and shift. And then I come back in later and check. And if there's anything else to do, then I do it. NAET stands for Nambudrapad Allergy Elimination Technique. Medical doctor, a chiropractor, and a licensed acupuncturist that was based out of the LA area in California. And she developed this technique using all of her 3 degrees and skills to come up with this technique, really, that utilizes a lot of those different things that I just talked about to desensitize the body to different allergens and sensitivities. There's so much hopelessness in the world right now, but there is hope. There's hope for healing. There's hope for your body is designed to heal itself. Sometimes it just needs a little bit of support to get it going in the right direction and the right path. Give us a try. Whether you're locally, come check us out. We have a pretty high success rate with people happy with our work. Try us out virtually. It's hope. Don't give up just yet, just because you've had a few other doctors say that you just have to live with this for the rest of your life, because that's the majority of our patients who just come in every day and they're just so excited that they found us and that they're feeling better and getting well.